So there are a lot of health metrics that I think are important to measure when you use weight loss drugs. And it goes back to the potential for adverse effects and in some ways the way they work. So if we look at the appetite-suppressing drugs, particularly the stimulants, we've got to be measuring vital signs. We've got to know what heart rate and blood pressure are. We need a baseline EKG. That's probably the bulk of it for those. Over time, I would tend to look at bone marrow and kidney function, liver function if you're on some of the ones that have some of the longer-acting drugs like the naltrexone and the topiramate. These drugs all have to get out of the body, and so some of them get out through the kidney and some get out through the liver. So you at least have to have some baseline values to understand if it's safe to prescribe. For the orlistat, the fat absorption blocker, there isn't a lot you need to measure up front, but I think it's worth looking at lipids, worth looking at kidney and liver function as people continue on the drugs, because you are changing the way the fat absorption in the gut and the nutrient absorption, some of the fat-soluble vitamins you have to pay attention to. When we look at the GLP-1 drugs, I think the most important thing, because they have the ability to cause so much more weight loss and potentially more muscle loss, I think it's really important to know where you're starting from. So I would want some kind of a body composition measurement done either with an electrical impedance device or a body composition by DEXA, some way to know what the starting map looked like. And I ask my patients to go quarterly to know over time what the weight they're losing is. With some of the GLP-1s, we've seen patients who've lost as much as 40% of the weight they've lost in muscle. So if I'm going to give you a drug that could cause you to lose, at best, to lose 5% of the muscle, and at worst, 40%, I think we have to track that. And then beyond that, it's nice to see what you're losing in fat, right? So if it's successful and you're able to show that most of the weight you're losing is fat and that you're clearly losing body fat, well, then you know you're winning. I think that in some people, the fat that's most important is visceral fat around the organs. It's a little harder to get your hands around that, to measure it. Some of the body composition testing done by DEXA is helpful for that. And in a patient who has a lot of visceral fat, that's the thing I'd want to measure, actually, because it has the highest impact on insulin resistance and on risk for fatty liver and hepatitis and even cirrhosis. In a person who's quite obese, you can measure waist circumference. You can measure BMI, although I would typically want a waist circumference done with that, and you can often use that as a surrogate for a while, but I would want to be knowing what's going on with muscle pretty quickly, and eventually I'd want to know about visceral fat in people as they got closer to goal. Most of the time in folks who are using the GLP-1s, there is some degree of insulin resistance, and they sometimes then benefit from looking at hemoglobin A1C and insulin levels, because we're not just looking at weight, we're looking at metabolic function.